Prior authorization gets all the headlines in healthcare billing, but the quiet, labor-intensive reality of claim attachments and supporting documentation is where your revenue cycle actually grinds to a halt. These requests, pulling progress notes, lab results, and referral letters to prove medical necessity, live in an operational no man's land. The clinical staff lacks the bandwidth to handle them, the front desk does not own them, and billers are consumed by charge entry. Over a 3-year timeline, the initial claim denial rate climbed from 10.2 to 11.8%. Breaking that down, Medicare Advantage denials spiked by nearly 5% in a single year, while commercial plan denials rose by 1.5%. Perfectly valid medical claims are being delayed or outright denied simply because no single team is strictly responsible for managing the mid-cycle documentation inbox. Fixing those preventable mistakes requires manual intervention, and the industry standard rework cost is $25 to $40 for every single denied claim. For a mid-sized practice processing 10,000 claims a month, rework translates to $47,000 monthly. That is $500,000 annually bleeding out. Meanwhile, the average denial amount tied to medical necessity spiked 70%, reaching $450. The administrative burden to chase down the paperwork and appeal these specific denials is so high that roughly 60% are never even resubmitted. Every missed documentation deadline represents pure revenue loss, quietly absorbed by the practice because they lack the human capacity to fight back. Claim attachments require meticulous, payer-specific manpower, and right now, medical practices do not have the staff to execute the work. According to benchmarks, annual turnover for billing and coding staff reached 32%. Filling a vacancy now takes an average of 68 days. Replacing them costs up to $12,000 in recruitment, onboarding, and lost productivity. The remaining staff are left to cover the gap. The average billing specialist is now handling up to 20% more claims per month, navigating complex payer portals and rigid 30-day documentation deadlines with zero margin for error. This creates a perpetual cycle. Understaffing leads to missed payer deadlines. Missed deadlines cause denials. Denials create manual rework, which triggers burnout, driving even more turnover. Healthcare revenue cycle experts consistently point to 2 operational principles to fix this: assign dedicated ownership to the task, and integrate the documentation workflow directly into the practice's electronic medical record system. To achieve this, highly efficient practices are stepping away from the fragile in-house model entirely and outsourcing the function to dedicated specialists. Staffingly provides this dedicated layer by deploying AAPC and AHIMA-credentialed specialists who operate natively inside your existing EMR, whether that is Epic, Athena, or NextGen, eliminating the need for screen shares or insecure data handoffs. These teams augment their human expertise with AI-driven predictive workload management. The system automatically routes incoming requests based on payer-specific playbooks and surfaces urgent 30-day deadlines well before they expire. This highly specialized approach builds an error-proof bridge directly into the most vulnerable point of the revenue cycle. Hiring an in-house billing specialist costs up to $75,000 in base salary. Add benefits and turnover, and the liability is massive. Staffingly flips this. They provide a dedicated, zero-turnover team starting at $399 per week. Along with the financial savings, practices receive guaranteed operational dividends. With an error rate below 1%, they deliver weekly performance dashboards tracking throughput, turnaround times, and return on investment. Shifting to this model transforms the claim attachments workflow from an unpredictable financial liability into a highly leveraged operational asset. Implementation is built for speed and security. Practices go live in exactly 14 days with full HIPAA compliance, including SOC 2 and HITRS certifications, all managed by a single dedicated coordinator. The engagement begins with a 14-day pilot and transitions to a flexible month-to-month agreement. There are no long-term traps. Staffingly has to earn your business every 30 days. The math is already proven. Staffingly has successfully supported over 800 practices across all 50 states, driving more than $14 million in validated client savings to date. If your practice relies on an overloaded, constantly turning over billing team for documentation workflows, the cost of staying the same is mathematically worse than the cost of changing. Reach out today and stop the bleed.